That's me, number 71. It's 1978, it's my senior year in high school. I was an outside linebacker. Football has always been a passion from the time I was in high school. I loved the chance to get outside, to be active, and nurture my competitive spirit. Even beyond those benefits, being part of a team taught me about confidence, about dedication, about teamwork. But there's actually one game I don't remember. It's this game. It's the Delaware All-Star game. I played in this just before I went to college. I was diagnosed with a concussion. In fact, I had 2 concussions during my football playing days. Now, in those days, we said I'd been dinged or my bell was rung. Back then, when I was playing sports, concussions weren't taken seriously. But today, they are, and that's why I'm doing this show. We're going to take a look at why the Centers for Disease Control are calling concussions an epidemic. Then, the at-home test that every parent should have in their home to screen for concussion. And we're going to take a turn and look at a documentary that shocked me. As a nation, we waste, listen to this carefully, 40% of our food, throwing out $180 billion every year. Coming up, what you can do about it. But first, I never gave much thought to my concussions until a show we did earlier this week when I went for a brain scan. It was part of an experiment. That was the personal moment that changed my perspective on concussions. While doing a story on the effects of caffeine e-cigarettes, I got unexpected news on my baseline brain scan.
You have an excess of delta waves. And when I see them,
these spots right here?
those right there. And they also actually go into your temporal lobes.
So what does that mean?
So in our experience, when we see high delta, it often correlates with people who've had concussions or traumatic brain injury in the past. So we've done 113,000 scans, and traumatic brain injury is one of the most common things we see.
The recommendation, I follow up MRI, magnetic resonance imaging.
I don't like medical tests. Like most people, you're worried about the outcomes.
Not the test itself, but what am I going to find out?
Can I have your name and date of birth, please? Great, thank you so much. You're all set. You can have a seat, okay?
My mind again turned to football.
The concussions that I remember were both in football. I only had 2 that I know of.
Hi, Dr. Eric.
Hey, Eric.
Nice to meet you.
How are
Come
you?
on in this way. Just gonna go over a few questions. No metal in the body, no pacemaker. Is that correct?
That's correct.
There's a locker here where you can lock your belongings.
A lot of warnings there.
Well, we have to make sure that there's no contraindications to the MRI.
The MRI uses magnetic field and radio waves to create detailed images of the organs and tissues within your body, monitored by a technician in the next room.
Okay, that was the first 90 seconds. How are you feeling?
I'm good.
Here we go with the next 2 scans. It's gonna be about 5 minutes. Are you okay?
I'm still doing fine, thank you.
But as the test continued, the estimated times seemed to be increasing.
These are the final 2 sequences. Keep your head very still because one of them is a repeat.
Okay.
This is the radiologist.
Hi, Angela Agnelli. I'm one of the neuroradiologists here. There's a small, tiny focus of high signal on this T2 weighted image here, which is a non-specific finding. These are some preliminary images. I'll have to analyze this data, and I will be able to discuss the results with you within a couple of days.
For the past 25 years, I've been on the other side of an MRI, and I got to say the worst thing about being the patient is having to be patient. It's the time to think while the technician is doing all the maneuvering, and you're wondering, what are they seeing? You've all been that, getting a test done and wondering, what are they actually seeing? Especially when they started to repeat the tests, I sort of felt that way. Who's felt that after a test or during a test? So that MRI was thankfully done at my hospital, and I entrusted my friends and colleagues to analyze the results. And I've asked them to join me today. We're going to start, though, with Dr. Sanjay Gupta, CNN's chief medical correspondent and an associate professor of neurosurgery at Emory University. And Dr. Angela Agnelli is a neuroradiologist at my hospital, New York Presbyterian. Thank you for being here. Dr. Agnelli was actually there when I had the studies done. You were pretty mum about the topic while you're looking at my images. And you have my permission, if you don't mind. I actually haven't heard it from you directly, so please share with everyone what you found.
Okay, so here we have an image of your brain. And on this sequence, this is a susceptibility weighted sequence, which allows me to see foci of hemorrhage, small dots of hemorrhage that you may have in your brain that you may not even know you had. These we can see many years later, and it's the effect of trauma, it can be secondary to calcifications, but in your case, you can see there are no areas that are very dark to suggest that you've had prior hemorrhage or hemorrhagic bruising.
So if I had concussions, they were not so bad that they led to bleeding in my head?
Correct.
And I know you put me through another series of tests which were uncomfortable. They said I had to hold my breath for 8 minutes, which is hard to do. and this is, but it's like, you know, psychedelic brain here. What are you looking at here?
Isn't this beautiful? This is a relatively new technique. It's called diffusion tensor imaging and tractography. And this allows us to see connections between the outside of the brain and deeper structures. But there is great potential for this technique, and we're very excited because we feel that it can in the future show what may not be apparent on an MRI. It's a great, potential new technique.
It's amazing, right? You have these big centers, the cities, if you will, in the brain, and those tracks are like the roads that connect those cities.
That's right.
The cities are important, but you want to make sure the roads are in good shape as well.
Just to give me comfort, so if I'm understanding correctly, I'm okay from what you can see.
Yeah, you're good. This is a very good-looking brain.
Good. All right.
You're okay?
So far, this part of me is okay. So there are over 3 million concussions every year, which is, again, why I'm passionate about this. And the CDC says that concussions have increased 200% in high school students. So I'm going to explain to everybody why I'm so concerned about this and why, paradoxically, it's not the people you'd expect to get hurt. So let's say two athletes are colliding on a field, right? They collide, and when you get hit, the brain moves around inside this fluid sort of wrap that it has around it. And when the brain hits the skull, which is hard to protect it, you actually traumatize the brain. The brain is the consistency of Jell-O or a soft, hard-boiled egg. So inside the brain, where normally these tracks that you just saw in my head are connecting different thought processes and chemicals are going back and forth, when the brain shook up like that, these very delicate strands, much thinner than a hair strand, snap. And see that snap? Now the connection can't work anymore, so you begin to have vital processes not working. And what happens if you're a big person? You actually cushion the brain better than if you're a thin person with not a lot of muscle. So younger people bang their brains around more than older, more mature people, even with the same impact. That's really important because it begins to make us think differently about who's at risk. And that's why women have a lot of problems, more than you'd expect, compared to men. That's why young people are more concerned than bigger folks. And of course, these can lead to bleeds and even strokes like we were fearful I may have had based on that earlier testing. So the question then becomes, what are we going to do about this? Dr. Laney, thank you very much for my images. I appreciate your patience with a bad patient. Sanjay, come let's talk about this. So even though there's no visual damage on all these images, and we did every image we could to make sure, does it mean that I didn't have damage to my brain at the time of the concussions?
It's a good sign, but it's not absolutely conclusive with these sorts of things, in part because this happened a long time ago. You may have had some damage at that time, and your brain healed itself. Our brains can heal themselves. The biggest thing, and you say this all the time to your patients, is how are you doing? And you can obviously answer that question, but also there's cognitive tests, where we actually measure how well is your brain working, the function of your brain.
No, I feel great, and I would never have thought about this if it wasn't for that little experiment we had tried that revealed those changes in my EEG waves.
Right.
But I'm actually speaking for a lot of you out there. Many of us had heads that got bumped, and we may not have even been aware we had a concussion. It could happen when we were very, very young, may have happened when we should have been aware, but we didn't think about it at the time because we had vernaculars like we got my bell rung.
That's right.
And the research actually shows that repeatedly banging your head actually causes significant changes. You're a neurosurgeon, I'll let you narrate this, but these are two pictures of brains. And please tell us what we're looking at.
Well, on the left is a fairly normal looking brain. And the right, you can obviously see the difference. Those brown areas, those are these areas where you start to deposit certain types of proteins, plaques, they're called oftentimes. We think about in the context of Alzheimer's disease, which is the most frightening thing. When we talk about these repeated blows to the head causing what they call CTE, that is a sort of Alzheimer's-like disease. That's what you sort of need to know about it. It infiltrates the brain the same way. You have the brain as a sponge. It deposits itself within the sponge. You can't just remove things that are inside a sponge. And it sort of gums up those highways that we were just looking at in someone's brain.
So there's some folks who may not be quite as sharp as they should be. Maybe they feel foggy, and it might be from some of these chronic issues with head injuries, which is worrisome.
It is worrisome. And I'll tell you something else I think is very interesting. We tend to think about it in the context of memory. How well do you remember as compared to how well you remembered before? Very important question, but it can be other things as well. Headaches, very, very important. These headaches can be debilitating. mood changes, significant mood changes. Why is someone just having sudden bouts of depression, bouts of mood changes? Could it be related? Not always, but that's certainly something to think about. So, and those can be really profound.
Yeah, I didn't realize that emotional changes were a big part of this equation.
Yes. In the same areas of the brain that are responsible for emotion, the nucleus accumbens, you don't need to remember that name, but that's sort of the seat of emotion in our brain. They can also be affected by this.
So why is it that young people are having injuries and we're missing them? And are those injuries worse than when they happen in older folks?
Yeah, well, first of all, I think there's a cultural change that you just talked about. I mean, we talk about concussions now like we never have before. And by the way, even the term concussion, people will say that's not even a good term. We should call it a brain injury. It's a brain injury is what it is. And if you talk about it like a brain injury, everything changes. Your family will respond to it differently, doctors respond to it differently, coaches respond to it differently. You as a patient will think about it differently if it's a brain injury versus it just got my bell rung. Young people in particular, their brains have not been fully developed yet. And what that means is you sort of put this, you got the brain, you sort of put this glue down on it, right? It's called myelin. Glue, think about it like hairspray. It locks it all into place, right? When that glue's not on there and you suddenly jostle it around, you can imagine some of those fibers coming apart more easily as a result of that glue not being there.
So if folks are worried about concussions, and they should be, what can they do to alleviate damage if it occurs?
Well, one of the things that we have found really pretty good evidence around now is something simple, and they are omega-3 fatty acids. Now, omega-3 fish oil, a lot of people take them. You may recommend them for decreasing the risk of heart problems. Fish oil is really spectacular for this reason. One is that it actually can cross the blood-brain barrier pretty well. Things have a hard time getting to the brain. Second of all, some of the components of fish oil make up the same building blocks you want to start using to repair the brain. There's not a lot of substances that do this. So if you or your child has had a concussion, using fish oil can be very helpful. And even in people who are players but are in the off season, using it at a lower dose regularly can be very helpful as well. It can help diminish the impact of a concussion.
So after all that we've talked about, after all you've heard, what would you do if you were a parent and you had a kid playing contact sports? We're going to find out how some parents and their kids are dealing with the new age of concussions. Stay here.